Hello, ladies and gentlemen. This is she, the MP, with some healthcare education or information, whichever you want to call it. And today, let's talk about insulin resistance. Insulin resistance is a condition where the body's cells don't respond properly to insulin. Insulin is a hormone that helps regulate the blood sugar, right? Or the glucose. So, normally, insulin is released from the pancreas in response to the food that we eat, mainly the sugars and simple carbs. Insulin allows glucose to enter into the cell and be used for energy. But in insulin resistance, the cells become less sensitive to insulin, meaning they don't take the glucose in as efficiently. And as a result, the pancreas starts shooting out more insulin to compensate for the cells not taking the insulin in, or the cells not allowing the insulin to push the glucose in. And over time, this lead to higher blood sugar levels, and then prediabetes, and then eventually diabetes type 2. Insulin resistance is a early warning sign that your body is having problems managing sugar. And most of the time, long before, like up to 10 years before you become a diabetic, your body start resisting the insulin that your pancreas is shooting out. So did you know that? Did you know that insulin resistance can show up to 10 years before you're actually diagnosed with type 2 diabetes? Because it's true. But how often have you went to your doctor and had your insulin level checked? Not often, I bet. Most doctors or most providers don't check the insulin level unless it's necessary, unless something is going on. And even if the symptoms show up that you have insulin resistance, they generally don't check the insulin levels. So most people would answer no to that question, or they don't even know that their insulin level has been checked. A high fasting insulin level is a strong, like super strong indicator that this condition exists. Insulin resistance exists. Then there's this other test. It's pretty accurate. It's called HOMA IR, and it can estimate the insulin resistance based on your blood sugar levels and your insulin levels. HOMO IR stands for Homeostatic Model Assessment of Insulin. And the HOMO IR test is a straightforward situation that uses the mathematical formula to measure insulin resistance. So, what are some signs of insulin resistance, you ask? Insulin resistance and prediabetes usually have no overt signs, right? So, some people with insulin resistance and prediabetes will have like those darkened marks on the side and the back of their necks. They'll have like those creases, and it's really, really dark, hyperpigmented on the back of their neck, or under their armpits. It's hyperpigmented. Another sign is people have like those small skin tags, like those little moles, flesh color. I call them flesh colored moles because they are flesh colored generally, but they'll have flesh colored moles on their neck or on their face. And this is a sign of insulin resistance. What causes insulin resistance? Well, the main cause, the main risk factor for insulin resistance is being overweight or being obese. And especially if you carry a lot of weight around your midsection in your belly area. Other risk factors are overeating, these ultra processed foods, the standard American diet, the SAD diet, lack of exercise, inflammation, eating or drinking lots of added sugars, smoking, and then some ethnicities that are at higher risk for insulin resistance is Hispanics, Asians, and of course, African Americans. So genetics play a huge role in insulin resistance. Also, if you have abnormal gut biome, people be taking those probiotics because they want to avoid the abnormal um, gut biome or gut microorganisms. This causes inflammation, which increases your risk for insulin resistance. And if insulin resistance is left untreated, then it can lead to, of course, prediabetes. And that's just when your blood sugar is at higher than normal levels. Within 10 years or before 10 years, it could lead to type 2 diabetes. And in fact, about 50% of the people who have insulin resistance will develop type 2 diabetes, will become amongst that 30 million Americans who have type 2 diabetes. The other thing it can lead to is metabolic syndrome. And metabolic syndrome is just a cluster of illnesses that we call metabolic syndrome. And the cluster includes high blood pressure, high blood sugar, excess belly fat, and high cholesterol or high triglyceride levels. So get your cholesterol level checked. We talked about that before. Also, heart disease. Insulin resistance leads to heart disease. It leads to fatty liver disease, which is the buildup of fat around your liver, in and around your liver. Pancreatitis, which is when your pancreas become inflamed. Polycystic ovarian syndrome. A lot of women have PCOS and they're having problems having babies, and they're having other problems, and they don't realize or don't understand that they have insulin resistance, or they have had insulin resistance over the years. And a simple test, fasting insulin level, will let them know. Insulin resistance also increases your risk for Alzheimer's, dementia, and cancer later on in life. So it's very, very, very important that if you identify that you might have insulin resistance, that you get your doctor to check the fasting insulin level just to see if your insulin levels are high. And if your insulin levels are high, then you put together a treatment plan. Your provider with you will put together a treatment plan to get your insulin in perfect balance, do what needs to be done to get your insulin levels in perfect balance so we can avoid all those things. A number of other blood tests can be done, which can indicate or point in the direction of insulin resistance. First of all, it's that inexpensive, quick fasting insulin level. The next thing would be the hemoglobin A1C, which is just a test where it's a blood test, and they test the amount of the amount of glucose sticking to your red blood cells over a 3-month period. And if it's high, over 6.4, it lets you know that you already have diabetes. 5.5 to 6.4 is 5.7 to 6.4 lets you know that you're pre-diabetic. 6.5 and above, you're already diabetic, right? So that'll just let you know that you have had insulin resistance. And pre-diabetes lets you know that you have insulin resistance and that you need to get things in order. You need to get your eating, you need to get your exercising, and any other treatment modalities that your provider wants to implement. You need to start following those things because diabetes is a headache. We'll talk about that later. Anyway, another test is the oral glucose tolerance test, and that just checks your blood sugar also. If your blood sugar levels are high, then it indicates that you have probably insulin resistance. But again, the most effective, cheapest way for your provider to check if you have insulin resistance, the quickest way is to do a fasting insulin level. A simple fasting insulin level is a blood test. So listen up. If you think you have insulin resistance, the darkened neck, the darkened armpits, the skin tags, the little moles, flesh tone moles, infections, frequent infections, go to your provider and get tested. All right. This is she, the MP. Have a marvelous day. Peace. Thank you.